and alternative medicine, as well as other lifestyle choices that promote and enhance human health and well-being. I'm Jean Hart, filling in for Lauren Serven, and tonight I'm pleased to have with us Hilary Norcia, Community Health Coordinator, and Lori DiPietro, Health Educator, both from the Central Connecticut Health District. Welcome, ladies.
Thanks for having us. Thank you.
My pleasure, totally. We've got a lot of information to cover,
yes,
so
we do.
Basically I'll start by asking both of you to just give a brief background of your experience.
Sure. I have my master's in public health that I received back in 2000, so I've been practicing public health, specifically community health education, for 12 years now. I've worked at several hospitals and nonprofit agencies, including the American Cancer Society and the American Heart Association, and I've almost been here for 5 years doing writing grants and then implementing those grant programs for this health district.
Great. And Lori?
I received my Bachelor of Science in Public Health from Southern Connecticut University in 2011, just last year. I was actually the intern. I was actually Hilary's intern for 6 months.
Yes.
And then they hired me to be the health educator, so it'll be a year in August. So
congratulations.
Thank you. Thank you.
Hilary, could you, or Lori, whoever is assigned to discuss these different topics, give us the information about when the Central Connecticut Health District was formed, as well as what its mission entails.
Okay. Well, the Central Connecticut Health District was formed in 1996. It originally started out as the Rocky Hill Weathersfield Health District. In 1988, Berlin joined, and then in 2006, Newington joined, so it became the Central Connecticut Health District. It's made up of 96,949 people in all the 4 towns. And the mission statement is the Central Connecticut Health District is committed to improving the quality of life in our communities through prevention of disease and injury, fostering a healthy environment, and promotion of the health of our residents.
Can I ask who funds the agency? It must be the 4 towns together.
Well, actually, we get funded several different ways. One of the ways is through the state, through a per capita grant. So they do it by our population and give us so much money per our population. And then we also get money, each town pays a fee to be part of the health district. Whatever their population is, there's a rate, a per capita rate. And then we also get income from grants and also from flu clinics and inspections. We charge restaurants a fee to, for
Inspect
a license.
them.
For a
license and inspection.
And we also, and nail salons and pools and temporary food licenses. So those are the main ways that we get income.
Okay. I'd like to start by focusing on the community education side of your agency, and particularly as it relates to nutrition and exercise. I'm not sure which of you is.
Well, Lori can talk about our recent our block grant with the nutrition.
Okay. Do you want me to go first? Do you want to talk
Sure.
about Achieve first?
Yeah, I think it would probably be better if we talk about Achieve first. Our Achieve grant, it's a 2-year grant from the Department of Public Health. That started.
I'm sorry, I don't mean to interrupt.
Okay.
Could you tell us what Achieve, the acronym, stands for?
Yeah, I always have to write it down because it is kind of
long.
complicated.
Yeah.
A lot of acronyms. Action Communities for Health, Innovation, and Environmental Change.
Okay, and you recently received a 2-year, $50,000 grant from the state?
Yes. We're just coming to the end of year 1. And year 1 was sort of the planning phase. And what it is, it's not a program grant. What it is a policy and environmental change grant. The key word change. We want to make changes in the community on policies and make it sustainable over time. And so we've chosen 3 different areas to look at through this grant: nutrition, physical activity, and tobacco use. And
all problem areas in our country. Yes.
And for nutrition, we've decided, we did an assessment first of all of all the towns and what our assets were and where our weaknesses were. And so most of our weaknesses fell in those 3 areas. So policy-wise, so for tobacco, for instance, we're going to concentrate on getting municipal properties tobacco-free, such as town halls, parks,
Wow.
et cetera, and schools. Most schools do have smoke-free policies, but if they don't, we want to try to do it, especially at sporting events and things. And then for nutrition, we're looking at promoting farmers markets, community gardens, and fresh fruit and vegetables. Yeah, and also giving
At the food banks.
Yes.
Uh-huh.
Giving leftover. Also portion size at restaurants we're looking at, and school nutrition.
Along those lines, I remember reading that you were doing a gardening workshop in the spring.
Yes, we did do that.
That was very successful, as I understand, because
Yes,
it was
and-
filled when I called.
Right, it's very successful. We had a waiting list. It took place in Newington at the Stonehenge nursery, and it was so successful that we decided to do it again next year with funding from the state. But we're going to do it in every town, so that everybody from each town can have an opportunity. Hopefully, if they want to.
So was that one focused just on Newington?
It took place in Newington, but we offered it. We always offer all our programs to all 4 towns.
So that one was just so popular that
Yeah.
all the 4 residents of all the 4 towns just couldn't participate?
Yeah,
Is that the idea?
I guess just some people, it was easier for, most of the participants were from Wethersfield, actually.
Wow.
Wethersfield and Newington. So, and a couple from Berlin. So it was kind of a mix,
Right.
but we like to offer all our programs in each town to make it available. So that we do that with all our programs.
You may know that we have our farmers market
Yes.
has returned at a
Yes.
different location this year. It's at the Solomon Wells House on the corner of State and Hartford Ave. So we're happy to have them.
Yeah,
But
we
I think
actually are supporting them. We've helped them promote the program, and same with all the other farmers markets. The one in Berlin and the one in Newington. We've made brochures and passed them out and helped them really promote the farmers market in each town.
that's wonderful, especially this time of year when all
Yeah.
of the veggies start popping out of the ground.
Yeah. And then the last part of the Achieve grant, which one of the most important, I think, to fight obesity is physical activity.
Yes.
And we are actually, we're doing a trail awareness because we have many trails in our towns. I counted them, I think, yesterday or the day before. There's almost like 50 trails, even though some of them are short. But I don't think anyone really knows about them in the towns.
Well,
so we want to promote those so people will do more physical activity with their families.
we have a fellow in Wethersfield who's very knowledgeable about the trails in Wethersfield, down in the meadows. And he either has done a show or will be doing a show.
Well, if you're out there,
Yeah, Jim Woodworth, are you listening?
Are you listening? You can join because we're going to be having a district trail day in June 2013.
Oh, next year.
Yeah, so if you're out there, you can join our planning team. Thank you.
June, I'm going to write this down to 2013. Okay.
Yes.
Give Jim a call. Then the other thing I wanted to ask is, did you say to me that you are having a biking, hiking kind of event this summer? Or maybe that was Jim. I'm thinking of Jim.
Yeah,
There's
thinking of Jim. No, we're not doing that.
Okay, because maybe I should hook you up with Jim because
Yeah,
then he could
sounds
share his
good.
information with all the towns.
Absolutely.
Yeah.
The more the merrier.
Right. So as far as nutrition goes, I think I read in your literature that you work with a registered dietitian.
Yes, we did. One thing quickly before we talk about the nutrition class, I did want to mention that with the Achieve, we actually have a committee of people
Right.
that are community stakeholders. So we have some members of our board. We have a board of directors that oversees us. So there's 11 of them. They're appointed by each of the town councils. So we have a few that sit in, as well as people from the YMCA, the Tri-Town YMCA. We have different town managers. And people like
Parks
that.
and Rec
Parks and
Director
Rec
from
Director.
Westfield.
Kathy Bagley,
Yes.
lovely lady.
Yeah.
Hi, Kathy out there.
Kathy, thanks for all you do, kiddo.
Yeah. So we do have quite a support system from the different towns to kind of help us tackle these issues and make changes in our towns. But with nutrition, we did actually work with a registered dietitian. We conducted 3 sets of 4 nutrition classes. The first set was in January, then in April and May. And there was actually quite a good turnout. We received the money, the funding from our state block grant. It's the Preventative Health and Health Services block grant. And it's,
Excuse me, is that different from the Achieve grant?
Yes.
Oh, wow.
Yes.
Good for you.
The block grant is money that's given to us by the Connecticut Department of Public Health. It's money that you basically just are given every year. And there's a different set of topics you can cover. Based on our community assessment that we had done, we had found that a lot of people in our communities and our towns don't eat the proper amount of fruits and vegetables. There's a high incidence rate of obesity, as there is everywhere. So we thought it would be best to conduct nutrition classes and gardening classes to teach people how to eat well, how to grow their own fruits and vegetables, so it's at a lower cost. And things like that. So this year, it was we received $12,000 for the grant that was split between the nutrition classes and the gardening classes. And the nutrition classes were actually held at the Stop and Shop in Rocky Hill. There was a tour at the very end. The first 3 classes were held at the Pickens Center, here at the Pickens Center. And they were open to all the residents in the towns. And people could just come and learn using the USDA guidelines, the Choose My Plate. That's the big movement now that Michelle Obama and Let's Move, and
Yes.
that's been going on. So they were pretty successful, and so were the gardening classes. The gardening classes were very successful. That was
And we actually created a gardening guide that's available on our website.
Fabulous.
And we gave that out to each participant.
Would you like to give the website so people can access all of this great information?
Yeah, it's www. Where's the? Oh,
There we
there.
go.
On camera. www.ccthd.org.
Okay. Thank you. Is there any plan to repeat the nutrition classes into the fall when we start getting into the holiday season and so on?
Well, the block grant funding actually is over for this year on June 30th, just the end of this week. And then next year starts up again. So, we have the same, pretty similar choices of...
They kind of changed the nutrition. It used to be called nutrition and obesity, and they've changed it to just chronic disease management, like policy. Because they want to, that's why Achieve, it kind of goes well, piggybacks off Achieve, because they want to see more sustainability instead of just doing a program and it ends, and that's the end of it.
Right.
So that's how they sort of changed it a little bit. So we chose that one
Okay.
to do.
So the registered dietitian, I'm sure she gave some wonderful information. Is there any program that helps people who are in dire need of counseling, nutrition counseling?
We'd probably refer them, we don't do that.
Okay.
We'd probably refer them to the local hospitals.
Okay, so
Around.
they
do
pick
that
up
kind
the
of thing.
ball. Yeah.
Yes.
All right. Is there anything else you need to add about any of those things that we just discussed, namely nutrition, exercise? And
Well, we will be getting the block grant again next year. It's an additional $12,000. It's a whole new year. We are going to be continuing, as we started to discuss before, the gardening classes. We're going to open them in all 4 towns, at nurseries in all 4 towns. And all residents are again, welcome to come. And we're also going to be doing the District Trail Day in June of next year. We're actually going to have it coincide with Connecticut Trail Day, conducted by the Connecticut Forest and Park Association.
right.
So it's usually the first weekend in June.
I know my neighbor Jim Woodworth is involved in the Trail
Right,
Day, so I think it's limited to just Weathersfield, but maybe we can expand his horizons.
What we plan on doing for that is having like an event in each town.
Right.
So maybe Jim could be in charge of the Weathersfield event.
I'll talk to him.
Yeah, we get to know each other, Jim.
Is there a fee, by the way, for the gardening class?
No.
Workshop, I should say?
No, there isn't.
No? Oh, great. That's good. No wonder it fills up so quickly.
Most of our programs are free
All
to
right.
the public.
Now, is there any plan to have, say, cold weather crops, classes on that? Because there are things you can do in September.
Yeah, I think they did talk about like when to grow the different zones that Connecticut's in, and when to grow different vegetables and things like that.
Okay.
I mean, from a personal point of view, I was like planted Brussels sprouts, and I was all excited about them, and I found out that they just come out in the fall, like they won't be ready till like November.
Right.
I was really upset about that. They're just sitting there.
Yeah.
I can't eat my Brussels sprouts.
Well, that's my point, because there are a lot of things that, pumpkins and different types of squash that are very healthy that you can plant in the summertime, but, don't bear fruit until fall-ish.
Yeah.
Anyway, this is all great stuff. Thank you for all the work you do.
We enjoy it.
Yeah, absolutely.
And just letting our audience know about what's available is important as well. The other thing that I wanted to cover, which is close to my heart because I have an elderly mother, is your program, falls prevention program called A Matter of Balance.
Right.
Is that correct?
Yes, this is a nationally known program, and it's an evidence-based program, meaning there's research behind it. So we know it's recognized, and we know it works. And what it is, it's an 8-week program where maximum size of class is about 12, and you talk about just about ways to prevent falls, strategies in the home, do a home assessment. They do one. You don't go into the home, but they do one in the class, and then we suggest they go home and try and make these changes. But in class 3, there does start exercise. We show them just different exercises they could do to prevent falls. But it's not, I stress this, it's not an exercise program.
Right.
A lot of people come and say, oh good, I get to do exercise for an hour and a half, and that's not what it's about. That's part of it. The other part is education about different ways you can prevent falls.
Like, for instance, exercises meaning how to lift your feet, strengthen the feet.
Exercises, like, like there's one like this with your wrists, because you want to be able to, if you fall,
get yourself back up.
Get yourself up with stronger wrists. And there's like feet, rolling the ankles, doing this, all sorts of stuff. Like, it's strengthening.
Great.
So that people, because the biggest problem, I think one of the biggest problems with the elderly is that they don't move, and that hurts them more than moving.
Yeah.
In the long run.
My mother, until recently, was doing aerobics twice a week, and she's going to be 94 next month.
Good for her. She should keep it up.
That's going to be a struggle right now. She's been ill for several months, so I think she's lost her confidence, which was my next point. A part of the falls prevention is to get your confidence back about not falling again.
It's also to not be aggressive, but on the other hand, be assertive. Ask for help when you need it.
Yes.
If you're in the grocery store, don't sit there and try and get that can on the top shelf. Ask someone in the aisle, and I'm sure they'll happy to get it for you.
Yeah.
Things like that.
Yeah.
And we want to promote them going out to a movie. And a lot of elderly are afraid because they think they might fall, or if it's raining, they might slip. And in the dark, there's things like you can do. You can get a cab with your friend, share a cab.
Yeah.
And then you don't have to worry about driving, and you have someone to go with.
Or get someone who's younger and is willing to drive at night.
Exactly.
Yeah, I tried to encourage my mother to continue that. She did it for a long, long time. Going to bingo at night. God love her. I just want that momentum to not halt, which is, I think people tend to think, well, I'm old, so I better stop.
Yeah, this program, we're very lucky, is sponsored, funded by the Jefferson House.
Great.
In Newington, and it's open to all of our towns, and it's administered by the Hartford Injury Prevention Center, which is part of the Connecticut Children's Medical Center. They partner together, and we're sort of like a subcontractor to them and help them out to administer the program in our towns.
Now, do all of the regions throughout Connecticut have this kind of a program for elderly?
No.
Oh.
We're pretty much it for Connecticut.
Really?
Yeah, there's a couple here and there, but they don't do it the extent that we do it.
Oh, that's a shame.
Yeah, it is a shame because it's national. But hopefully it's going to catch on. And CCMC, from what I understand, does have plans on expanding to towns further. Right now they do about 12 towns. They want to expand. And hopefully it will catch on and people will want to become master trainers and go for training. And then they can do it in their part of the state.
You mentioned Jefferson House, which is a Hartford Hospital organization.
Yes.
Does St. Francis have anything that you know of for falls prevention?
I don't know. They might.
Yeah.
I'm not sure.
That'd be something to follow up on because that's a very necessary learning experience for so many people who don't realize that there's a strategy to getting around falls. All right. The next thing, I know this is close to your heart, is the asthma project called Putting on Airs. And I understand that in May 1st to be exact, you had a breakfast at the Legislative Office building for World Asthma Day. So can you tell us about that, please?
Yeah, World Asthma Day, we had over 100 people come in and out of the Legislative Office building, visiting all our vendors. We had about 12 vendors who all, do have different resources about asthma or different programs that they wanted to let the public know about. But the more important piece of this year, we did it a little differently. We had a legislative breakfast because there's two areas that we want the legislators to know about and to help us lobby for in the future. One is to get asthma action plans mandated in the state. And the reason for that is because...
Let me just interrupt you.
Sure.
What is an asthma action
plan? I was just going to say.
Sorry.
An asthma action plan is sort of a template that the doctor fills out that they tell you when to take your medication that you should take all the time. Then there's a rescue medication that you take when you have, an aspiration. And then there's the sick plan for when you're sick because asthmatics tend to get sicker. Because they have asthma, they get more bronchitis and things like that. So this plan details everything you need to know, so there's no mistakes made, and so you can follow it. And a lot of doctors don't do it. They just scribble on a piece of paper. And this should be given to the school nurse, the parent should have a copy, the primary care, and a specialist. There should be 4 copies out there. And it's not very common that this is done.
This is not limited to children, though, is it?
No, we do adult visits if necessary, but most of the time it's children.
The thing that I would be concerned about, especially with elderly folks, is remembering when to take the medications.
Yeah, well, that's why this asthma plan is perfect because it's color coded with red, green, yellow, and red.
Yeah.
Green, you're okay, but you should still be taking your daily medication. Yellow is, you're sort of having issues. That means your asthma really isn't being managed well. And red is like you're having a serious issue and you need to call 911, go to the emergency room. We don't want to get to red.
Absolutely. This is all about prevention.
This is all about prevention and education. And with the Putting on Airs program, we go into the home and assess the home for triggers that might be causing more issues like dander from pets, dust mites, mold, water leakage. A lot of times we find that houses are way too humid, so we recommend dehumidifiers. A lot of the times we see kids' rooms with stuffed animals, which is a bad thing, scented candles, etc. So
which triggers an attack?
Which triggers, And then I just went to a house recently where they were spraying stuff like Lysol all over the house and using scented spray for the carpets. That's a big no-no. That's like, and we do recommendations. We write all this out for them. We do recommendations, and we do a 2-week follow-up, 3-month, and 6-month. So there is follow-up with this program.
That's wonderful.
We don't just leave the house and say, "Have a nice day."
Yeah.
Hope you don't get asthma again. Good luck.
Asthma can also be triggered by environmental things as well, right? Like pollens and
pollen. Also rodents.
Oh wow.
Like mice, rats, cockroaches.
Right. So depending on where you live, those things are issues.
Right. And a lot of the times it's in the low income like the housing, and also, you know, we also, when we go in, we look for other things, because we partner with the Healthy Homes program out of Hartford, and we make referrals to them if necessary. Like if we see lead peel, you know, paint that might have lead, because any house before 1970, it's a possibility that their house may have lead, and so they have money to try to deal with that. So we just recently started partnering with them, and we make referrals.
That triggers a question about screens. Recently, well, I shouldn't say many, several children fell out of windows because of faulty screens. Is that something that you do when you assess a home?
Yeah, we would look for that, like, you know, say that you better, you know, secure these screens. Yeah,
or put them in the first place.
Yeah,
you know?
Right, exactly.
Yeah.
Right.
And our sanitarians actually have been called out to assess lead complaints. You know, if we get a call that, you know, someone is very ill because of lead, because lead can make you very sick. You know, our sanitarians will go out and inspect. They don't just do restaurant inspections or pool inspections. You know, they will call and go out to different complaints, including lead.
Well, that's wonderful. This is a very comprehensive service. I'm very happy that you're sharing all of this with us tonight.
Another thing with the Asthma Day that's really important is we developed a consensus statement. There's a statewide asthma advisory council that I'm a part of, and we devised this consensus statement where we want to lobby for a section of insurance that you can bill, like primary care providers can bill for health asthma education. Right now, there's no code for asthma education. For
doctors to bill.
Doctors or certified or APRNs or anybody, if they want to do asthma education at your visit the specialist, they don't get reimbursed for that.
So basically the discussion doesn't happen.
Yeah, or
because they're not reimbursed.
It's very limited. It's like, okay, here's your inhaler. Here, I wrote down what you have to do. If you have any questions, call me later.
Yeah, well, we all know how quick doctors' visits are today, which is
and we're
sad.
looking at the within this consensus statement. We're looking at the medical home model, where everything happens in one place. You're not going here and there, so that it's comprehensive and everyone knows. Everyone knows what the right hand, what the left hand is doing, that saying there. So.
Yeah, coordination between doctors is crucial. I had a sister who was very, very sick because the doctors weren't communicating about what medications she was taking and how it was affecting her body. And hopefully in time.
We reached about, there was 50 people at the legislative breakfast, and we were able to make contact with about 8 legislators who said they would support.
That's wonderful.
When this bill is written, they would support. It hasn't been written yet, but we partner with the American Lung Association and the Cancer, so several other people who will probably help us write these bills in the future.
When you say 50 people, you mean 50 legislators?
No, it was 50, people from the community, Hartford area, and there were, but the legislators, they came in and out, and then they walked through the concourse, and we got their cars and things. So.
And 8 of them committed to helping?
Right, yeah, they said they...
That's wonderful.
And they're from the Public Health Committee, Education Committee. And we also did get some airtime on Channel 3.
Wonderful.
So
did you happen to get any legislators from your core towns?
I don't know if they were from any of our towns. We did have a few people, a few legislators actually stopped. They were interested. A few of the vendors that we were with did actually get to talk to them a little bit about the importance of having asthma action plans, and they seemed very interested, and information was exchanged and emails were exchanged, so it was good. It was
promising.
Good. Yeah,
very
promising.
Yeah, good.
And this has been done in other states. Mississippi has a law that you have to have an asthma action plan. So we're not going to reinvent the wheel here. We'll look at what's worked in other states and go from there.
And try to mimic it, yeah.
Right.
Yeah. Is there anything else you need to add about the asthma program?
Yeah, I just want to let everybody know out there in the viewing world that this program is available to all 4 of our towns, and it's a free service. And all you have to do is call me at 665-8571, and we can set up a time to come out to your home and do an assessment. You do have to have a diagnosis of asthma from a doctor, but we are very willing and able to come out to your home and do this assessment for you. So please call us, because it is a free service.
Yes. And once again, the 4 towns are Wethersfield, Rocky Hill, Newington, and Berlin.
Yes.
So if you live in any of those towns and have asthma problems in yourself or in your family, please call.
And we also, when we go on these visits, we give out mattress covers and pillow covers.
That's
for
wonderful.
free, and we also give out a lot of brochures, and they get a whole packet and everything. And we also do referrals to smoking cessation programs if they happen to be smoking. You know, anything that comes up, we try and help with, whether it's related to asthma or not, really.
Right. So basically you're referring them to a clinic or a hospital for smoking cessation?
Right.
Okay.
And the materials are in English and in Spanish that we give out.
Yeah.
Very helpful.
Any bilingual.
Because this program is a regional program. I'm in charge of the Region 2 Asthma Coalition. So there's 18 towns that participate in the Hartford area right now. So one is Hartford, one is New Britain. So we do have to have Spanish material and make sure we cover that in our education portion. Make it accessible. Yep.
And of course, if there's a smoker in the family, this could affect the little kids.
Yeah, smoking is probably the worst thing that we see.
Right.
That really affects it. And people think they can go smoke outside and come in and they're fine. No, you're bringing a secondhand smoke in with you.
Yes, not only that, it's absorbed by your clothing and your hair and so forth.
Yeah, exactly.
Yeah. One more thing. I think we've got some time. Can you talk about recommended cancer screenings that you're involved with?
Well, last year we did have a grant from the Komen Foundation where we offered free mammograms. We no longer have that grant, but we do still I still get some calls from time to time, and I refer them to the local hospitals around who have early detection programs and help with people with low income or who have no insurance. So we still do that, but the cancer, you still should, they say, the American Cancer Society says, you still should get a mammogram once a year, starting when you're 40 years old. There was some stuff out
controversy
there about 50 years old starting, but the Cancer Society sticks by there.
I have a sister who was above 40 years old, and you know, it was during that time when they were discussing, oh, you don't need it. And she just disregarded that whole thing and just went ahead and did it. And of course, they found it early.
Yeah, thank
goodness. Yes, so.
And then for colonoscopies, colon cancer, 50.
50?
50. Unless they do not know your family history, then they sometimes do it at 40 because they want to play it safe.
Right, but if you know your family history, what's the recommendation? 40?
Yeah.
Okay, and every 5 years after that?
If it comes out clear.
Okay.
Yeah.
And how about other types of cancers, for instance, prostate?
That's 50 also.
Yeah.
Unless family history, unless they find symptoms that are happening.
So
50 years old for men,
So none of these are covered by your agency. You just refer people
we just refer people to the American Cancer Society or hospitals, the cancer centers, etc.
One thing we are looking into doing is trying to. I'm actually in the process of trying to contact a local dermatologist to come out and conduct talks about skin cancer.
That was going to be my next question, since it's summertime.
Dermatologists out there that are interested in helping us do free skin cancer exams. We'd love to have you.
And talks, especially.
And talks, because we used to have this program and it was so popular. But unfortunately, the dermatologist that we used retired. So
that's a shame.
We'd love to have someone new and to offer it in all our 4 towns. So.
Well, you know, there are free dental exams offered now, so that's just the next step, I would think, especially in summertime, to offer a service like that to people who spend a lot of time in the sun, have little kids go to the beach, go to the lake, pool, whatever.
And melanoma is rampant now, so.
And can be deadly.
It can be deadly, right? So it's important to check your skin and check to see if you have any moles that have changed color or size, or if you notice anything in your skin that looks abnormal. So it's important to know what your skin is.
They also recommend if you go out in the sun, you should get checked yearly by a dermatologist, do a body scan. I know I do it. I go every year.
Well, I'm glad you said that. My husband plays a lot of golf, and he should get screened yearly, as you suggest. Yeah. When you talk, Lori, about moles that change color, can you tell us what that would mean? For instance, I have one here that I've had for life that is red. I think that's a mole. And at one point in my life, it was brown. So, but then it went back to red. Is there a sort of a guideline for people? Are you looking for brown or black or red?
As far as I know, I'm not entirely sure about the color, but they do say that if
the shape changes,
or if it gets bigger, I think if it becomes a little bit more sensitive.
They do say change color. I have heard.
Right. I have heard.
So you might want to.
I don't know if it's one specific color that they look for. Yeah, there you go.
You might want to.
I don't know. It just looks like a blood blister to me, but yeah.
Yeah. You never. It's never.
Yeah.
Better be safe than sorry.
Right, and as long as we're on that topic, is there a rule of thumb as far as SPF, or I believe that would stand for sun protection factor?
Generally, I think anything above 15 is probably the safe way to go. Again, with melanoma being so common now, it's not really worth it to get the nice, healthy glow. Having a base tan actually won't prevent sunburns.
A lot of people think that. They're like, well, I have a base tan, so now I can go out.
A lot of people go indoor tanning to kind of work on their tan, and then they go out in the sun and think they're okay. You're actually increasing your chance of melanoma.
Especially with the ultraviolet lamps that are used in those beds. Those are deadly.
I would say to play it safe, use 30 and above.
And if you are outside, be sure to kind of cover up, wear a hat, wear sunscreen. 15 to 30, of course, children have a higher SPF.
Yeah,
make sure you cover them all the time.
I'm sorry, you use 70 on?
My son.
Your son? Really?
And actually it works, because he went to camp today, said he didn't have one who looked exactly the same, no color, nothing. Which I was like, I want him to get sun. Because as a child, I think I got too much sun. Because back then, when in our generation, it was like, who cares, let's wear baby oil and put those things.
Yeah, copper tone, right? Yeah. Those reflective things for the nice brown face. Yeah, sure. But I think that kids, particularly in the summertime, are outdoors so much that it can be dangerous. But people don't think about it, especially, I would imagine, in lower income families. They're not educated in particular about what the sun does to your skin. Or they don't speak the language. But also, I think that, to me, we're changing as a society because, like you, when I was growing up, it's like, oh, get that golden glow. Yeah. And you feel like you're more attractive or you're more healthy, but...
It's still very much the same. I don't think, unfortunately...
Especially, I think, with, like, the high school and college age kids.
Right.
Especially
like,
let's go...
time.
Yeah, prom.
Oh,
prom
yes.
time. It's it's kind of prime time for tanning and things like that.
And, like, before college, kids go on spring break. They're like, I want to go tanning to get a base tan so I don't burn. Yeah, that's not going to happen.
Yeah, they're totally unaware of the danger.
Yeah.
Is there anything else that we should cover that I've missed?
I just want to mention we do senior dental. We have a grant from the North Central Area Agency on Aging, and we do senior dental cleanings in each town. And we have several coming up. You can call our main number that's on the screen if you want to find out when those dental clinics are, and you just call. And
do you need to call and make an appointment, or just show up?
No, you have to make an appointment.
All right.
And
so
we only do 10 a day.
Yeah. Okay, I'm going to give the number just in case anyone missed it. It's 860-721-2822. That's the main number for the Central Connecticut Health District. And the website is www.ccthd.org.
So yeah, and I really encourage people to go to the website because all the information that we just talked about is on there.
Right.
There's upcoming things on there.
Right. If you are a restaurant order or temporary food vendor, there's different forms you can print out there.
Right.
And bring to the health district. So it really is a great resource. It's very easy to navigate, very easily broken down. So it's a good tool. It's a good resource.
Great. Now, we didn't touch on some other things that you folks do, mainly environmental issues and sanitation and...
Yeah, that can be an upcoming show.
We'll have you back for sure because this has been so informational.
Flu clinics that we can talk about
flu clinics.
Later
yes.
when those come up.
Yes, perfect.
Let people know when and where they are. Yeah.
Right.
We do work with quite a good group of sanitarians that are very good at what they do, and they're very flexible and dedicated. So we have one in each town, and we have satellite offices. So they're available. They're there. So
it's not just restaurants, as you mentioned before. They'll do house inspections.
Pools. We also have. We thought it was important. Not every health district does this. We actually inspect nail salons as well.
That's very important.
Absolutely.
Yeah. So
absolutely.
There's a lot of cross-contamination with if your instruments are not completely clean.
Exactly.
Right.
So that's what we really want to make sure about.
Yeah.
So yeah, we can talk about all this, and we also have an emergency preparedness coordinator who does our emergency plans. If there was an epidemic or things like that, or if there was a hurricane or a tornado or something like that,
so
blackout.
It's not strictly health related then.
No,
it's weather connected as well,
and also health too. Like if there was a bad strain of flu that came up or something, or a smallpox or measles. Yeah.
SARS, God forbid.
Right, that we have a plan in place.
Right.
So she does that. Her name is Judy Torpy.
We actually have this Connecticut Guide to Emergency Preparedness that you can pick up in our office, along with some other information about being prepared in emergency. Elderly that have Alzheimer's or dementia, small children, and things of the sort.
And if you want to volunteer, we're always looking for volunteers.
Absolutely.
For our flu clinics or anything else we do, we welcome volunteers to our agency.
Good to know.
You can call a main number and call and ask about volunteering anytime.
Very good to know.
So I think that's a good place to end with volunteering, and thanks for having us.
Well, thank you for coming. I appreciate your time. I know you have busy days, both of you.
Yeah, we're happy to come back again to some more shows, maybe get some special guests to talk about specific topics. That would be wonderful. Okay. We'll be in touch, Hilary. Yes. Thank you again for joining us tonight. Good night.